So let's talk about something that's, well, it's a huge tension right at the heart of our society. It's this constant push and pull between keeping everybody healthy and protecting every single person's right to choose for themselves. And this clash, it really does affect all of us.
All right, to get started, just picture this. You walk into your doctor's office. The moment that door closes, the whole world kind of shrinks down to just you and them. That relationship, it's built on a very specific set of rules, and they're all about one person, you.
Right, and these principles are the bedrock of medical ethics. Your doctor's job is to respect your choices, that's autonomy, to do what's best for you, beneficence, to not hurt you, non-maleficence, and to be fair, justice. The key word in all of this, your. It's all about you.
Yeah, that's really the bottom line in clinical medicine. The focus is absolutely laser sharp. Every single decision, every piece of advice is all about what's best for the individual patient sitting right there in the room. Okay, but what happens when we pull the camera back, when we zoom way, way out, from just one person to a whole population of thousands or even millions? Well, as you're about to see, the entire ethical landscape just completely shifts.
And that's where we get this idea of public health. The U.S. Institute of Medicine put it perfectly. What we as a society do collectively to assure the conditions in which people can be healthy. That definition is so powerful because it's all about the shift from me to we. This isn't about treating one person. It's about creating a world where everyone gets a shot at being healthy.
And you can see the difference like crystal clear when you put them side by side. Clinical medicine. It's focused on the individual, and the goal is to cure something that's already wrong. Public health, on the other hand, is looking at the entire population. The goal isn't to cure, it's to prevent illness from ever taking hold. It targets the whole community, and even the environment.
And this is where things get really tricky. This is the core dilemma. What do we do when a policy that's designed to protect the whole community seems to step on the toes of your personal freedom?
You know, it's this fundamental tug of war between two ideas that we all really value. On one side, you've got the common good, this idea that we have a responsibility to protect the health of everyone. And on the other side, you have individual liberty, that powerful belief in a person's right to choose for themselves.
And this isn't just some minor detail. I mean, listen to this quote. The ethical conflict par excellence in public health arises from the tensions between the common good and the rights of individuals. It's saying this isn't a side issue, this is the defining ethical conflict in all of public health.
All right, so this all sounds a bit abstract, right? Let's make it real. Let's talk about something we've all seen, something we've all experienced: smoking bans.
The argument for a smoking ban is a classic common good move. It's really not about the smoker's health. It's about protecting other people from the proven harms of secondhand smoke. Think about restaurant workers, kids, or people with asthma. But the argument against the ban is just as straightforward. It's an issue of individual rights. It interferes with an adult's personal freedom and their choice to smoke.
Okay, here's another classic example, and this one can get, well, pretty heated. Let's talk about vaccinations. So, from the common good perspective, when lots of people get vaccinated, it creates something called herd immunity. It's like a protective shield for the whole community. And that shield is absolutely crucial for the most vulnerable, like newborns who are too young for the vaccine or cancer patients with weakened immune systems. But the individual rights perspective is all about autonomy, a person's fundamental right to refuse a medical treatment for themselves or for their kids.
So you see, right? We're back where we started. The simple, one-on-one rules from your doctor's office, they just don't quite fit these huge, messy, population-wide problems. The toolkit is just different.
And this is the big shift. The whole game changes. In your doctor's office, your autonomy, your choice, is often the #1 priority, the first among equals. But in public health ethics, the priorities often have to flip. Beneficence, doing good for the whole population, and justice, making sure things are fair for everyone, those often have to come first.
Okay, so if the old playbook doesn't work, then what? How in the world are we supposed to make these incredibly difficult decisions in a way that's fair and transparent and, well, ethical?
Well, the research actually points to a pretty clear path forward. It's not about just winging it. First, we need a special ethics framework designed specifically for public health. Second, that framework needs to be turned into clear professional codes of conduct so decisions aren't just made up on the fly. And third, public health professionals need real, ongoing training so they know how to handle these thorny ethical problems when they pop up.
Because at the end of the day, the goal here isn't for the common good to crush individual freedom or the other way around. It's about finding a balance. It's about trying to make these two really important values compatible with each other.
And that leaves us with the big question, the one that doesn't have an easy answer. It's a conversation every single society has to keep having. Where do we, as a society, draw that line? Where does our collective safety end and our personal freedom begin? The line has to be drawn somewhere. The question is, where?